Today I'll be telling you about wound infections after surgery for head and neck cancer, especially oral cancer. We have to do surgery as the first line of treatment. There are many causes for wound infections or delayed wound healing after this surgery. Inadequate blood supply to the flap of the reconstruction flap, uncontrolled diabetes, serous fluid keeps getting collected and is not absorbed by the body, there is a chance of secondary infection happening. Hello, I am Dr. Avinash Chaitanya, head and neck surgical oncologist. Today I will be telling you about wound infections after surgery for head and neck cancer. Generally, head and neck cancer, especially oral cancer, we have to do surgery as the first line of treatment, in which first the tumor is removed and the neck dissection is done, and in some cases we have to do a reconstruction also. So, there are many causes for wound infections or delayed wound healing after this surgery. Most of the time, it is affected by patient factors and surgical factors. When there is extensive dissection and prolonged surgery, there is always a chance of increased exposure of the tissues to environmental factors which can cause infection. Sometimes, inadequate blood supply to the flap of the reconstruction flap is also going to cause necrosis and infection of the flap and delayed wound healing. Some factors like decreased nutrition or poor nutrition for the patient after surgery or even prior to surgery, and uncontrolled diabetes, improper or inadequate antibiotics, and not using the drain for a long time. In some patients, when there is a long surgery and also there is a big defect, a drain has to be placed because there will be some amount of serous fluid which will be collected under the flaps, and that has to be drained out. When the serous fluid keeps getting collected and is not absorbed by the body, there is a chance of secondary infection happening. Also, in most of the head and neck cancers, there is one major problem: saliva. That saliva, which will be continuously secreted from the oral cavity, can seep in through minor holes or gaps between the sutures and can lead into a trickling into the neck and under the flaps and causes wound infection which have to be seriously treated. With these factors, it is very important to take care in the postoperative period for good wound hygiene. It has to be cleaned and dressed properly on a daily basis. You have to clean the wound with water, with soap water, and dry the wound, apply ointment. And also, it is very important that when a flap is indicated, the flap should be done. If there is inadequate surgery or improper flap placement, there is always a chance of salivary fistula to happen. Sometimes surgery after radiation also causes a problem in wound healing because of lack of blood supply to the flaps and the suture lines. So it is very important to select your patient very carefully and take adequate postoperative care for good and fast recovery of the wound. Thank you.